Hi, welcome back. It's Eyton Shalom with part 2 of my patient who does Jitsu, early middle-aged man who does Jitsu, who has shoulder pain without any tear. He has relatively normal range of motion, so it's nothing where he's needed to go to get an x-ray or anything like that. So I'm now needling the short and long heads of the biceps, and that's what I want to show you. Here is if you can visualize, we're looking from the front, the two attachments of the biceps, one on the humerus and one on the acromion complex, I'm just forgetting the name of this bone because I'm a bit hungry. That bone right there on the front of the scapula. And it's not the L.Ac joint, it's the acromion complex, I believe it's called. So let's put this away so I can sit down here. And I'm going to show you that here I've needled the long head of the biceps as well as the pec minor, where the pec minor crosses over. And so I had very strong release on these points here. And then there's the head of the biceps there. And so I'm going to do a little bit more of the pistoning technique. So this really released a lot the first time around. I don't know if you could see that his entire arm jumped and just now. And then I've also got the some of the other muscles here that act on the forearm. This was another one that had a really strong, oh, there we go. So his whole arm just released. So we're getting down towards the attachment of the middle and posterior deltoid here. And that was a really big release. I mean, his whole arm jumped. So, he does strength training. He does, what do you call those exercises? The ones where you're jumping?
Burpees.
Burpees. They're like Canadian Air Force exercises, but on steroids, where you do push-ups and then you jump up and down and then you go and do your push-up again. So, and there we go. That's a really good one. The whole forearm is moving, and there it is. And then I've also done the upper trapezius from the front there, which is also, and again, you're not just needling the trigger points and motor points of the muscles, you're also releasing the fascia, and the fascial train can cross over muscles, and it connects muscles to muscles in a different way than the muscles attaching to the bone by the tendons do. So that's what I'm doing, and I'm also doing one here, which I'm aiming it towards that acromion complex underneath the clavicle. Okay, thanks for tuning in.